Hi guys, hope you're doing well. Today we are going to be moving into chapter 14, which is going to be about cancer. The first portion, actually the only portion I'm really going to discuss in this video is what your book offers. At the end, if you pull up the PowerPoint that I have listed and provided on Blackboard within our course PowerPoints folder, you're going to find this PowerPoint, but at the end there's going to be additional information, and I've brought up some information specific to several different types of cancer. I'm not going to test you on that. I'm only going to test you on what the book offers and what I'm going to discuss with you today on this video. But I do recommend looking it over just because there's some very interesting information and I think very important information. So what is cancer? It is the abnormal, uncontrolled multiplication of cells which can ultimately cause death if left untreated. A couple terms to be familiar with: a tumor, I know you guys have all heard this, it's also referred to as a neoplasm, and it's a mass of tissue that really serves no purpose, and it can be benign or malignant. Benign meaning it's non-cancerous, malignant meaning it has cancerous tissue, cancer cells. And metastasis is another term, and that's the spread of cancer cells because they do not stick together as normal cells would, and therefore they may remain in the same, may not remain in the same site of the primary tumor. Cancer occurs when a small number of cells in a particular body system begins to replicate more quickly than expected without normal and expected planned cell death. All cells in the body replicate themselves, and all cells in the body should undergo planned cell death, but when genetic changes occur, cells may begin to grow out of control. And when the cells replicate quickly, they have no ability to spread, when the cells replicate quickly and have no ability to spread to another part of the body, the growth, known as a tumor, is considered benign. But if the cells have the characteristics that would allow them to grow beyond the tissue where they start, spreading through the blood or the lymphatic vessels, the tumor is considered malignant. While there are many reasons why this happens, one may be because of gene mutations present at birth passed on by a parent or parents. An example of this is the BRCA1 and BRCA2 gene mutations. Both substantially increase the lifetime risk for breast and ovarian cancer among those who test positive for these mutations. Many are choosing to have genetic mapping or testing done now, and this is so that they can determine if they carry a certain gene, this BRCA1 or BRCA2. They want to know if their mother or grandmother is carrying these genes so that they can be aware if they might also have them as well. While some prefer not to know if they carry these genes, if aware, drastic but life-saving measures can be taken. And this is an instance where some women, if they find out they have either of these genes, some women do take and men, very, very drastic measures and go ahead and ask to have a mastectomy and just remove the tissue so that the cancer cannot occur. Cigarette smoking is also another factor that can cause cancer, and it's the #1 preventable cause of cancer. In addition, it is estimated that 1/3 of all cancers in the U.S. are preventable with exercise. So another important piece of the puzzle there. I really like this infograph, and I recommend that you take a look at it. It's kind of showing how many cancers can be prevented due to lifestyle changes. And pay close attention to the size of the factor as it relates to the risk of cancer and subsequently the impact of a decreased risk of cancer. Every few years, the American Cancer Society publishes guidelines for nutrition and physical activity for people who have been diagnosed with cancer, for those in active treatment and for those in recovery. If an individual is currently undergoing active treatment, the dietary focus should be on making sure they're meeting their nutrient and calorie needs, maintain a healthy body weight and avoid losing muscle mass, and manage side effects related to nutrition and improving overall quality of life. Some consider using nutritional supplements during cancer treatment. It is important to know that some supplements may decrease the effectiveness of conventional treatments, and there is no evidence that nutritional supplements actually improve cancer treatment outcomes. When an individual is at a point of living disease-free or is stable with the disease, the ACS recommendations for achieving and maintaining a healthy body weight remain in place. There is increasing evidence that being overweight or obese is associated with a worse prognosis for people who have a diagnosis of cancer as well. The nutrition guidance for cancer survivors is to eat a variety of healthy foods from plant sources, limit the amount of processed meat and red meat, and consume 2.5 cups or more of vegetables and fruits each day, as well as choose whole grains rather than refined grain products. Fruits and vegetables are excellent sources of carotenoids, which act as antioxidants or have other anti-cancer effects, and phytochemicals, which are substances in plants that help protect against chronic diseases. Keep in mind, research indicates tobacco, fat and meat, alcohol, fried foods, and obesity or inactivity act as cancer promoters. Many cancer survivors experience one or more persistent adverse effects of their cancer treatments. Some of these may alter the safety of certain types of exercise, which would suggest that survivors with these issues undergo a pre-exercise evaluation before getting started to avoid the potential that exercise might do more harm than good. So, how do you know whether you can proceed with exercise in community or home-based, unsupervised setting versus needing a more structured, supervised exercise program after cancer? First, it is recommended that if it is desired to have a supervised program, then go find one. Second, if an individual is going to do low-intensity activities such as walking, it is likely they can proceed without supervision or evaluation. Go ahead and refer to Table 14.2 for guidelines on indications for the need for a pre-exercise evaluation. For example, persons with peripheral neuropathy, remember that's nerve damage, musculoskeletal issues, cancer in the bones, poor bone health, and possible heart disease should be evaluated by an outpatient rehabilitation clinician or physician. The evaluator would then make a determination about whether or not supervised exercise sessions are recommended. The benefits of exercise for persons who have had a diagnosis of cancer have been documented and include both physical and psychosocial benefits. Hundreds of randomized controlled trials have been completed that document benefits of specific exercise regimens for specific outcomes. For example, low-intensity aerobic activity has been shown to improve fatigue and quality of life. That said, to improve function and bone health may require some strength training. In general, it's recommended to avoid inactivity and return to activity as soon as possible, and to build up to 150 minutes of aerobic activity per week. Perform progressive strength training 2 to 3 times per week, and do flexibility activities on most days of the week. For aerobic exercise, the goal is to exercise 2 to 3 times per week until comfortable, and then able to add another session up to 6 sessions per week. It's always recommended to have at least 1 day of rest in there. An easy way to determine intensity is to use the talk but not sing rule. If you can sing while doing aerobic exercise, you are not working hard enough. In contrast, if you cannot talk while doing aerobic exercise, you're working too hard. Regarding time per session, a beginner exerciser who is starting after a cancer diagnosis may want to begin with as little as 5 to 10 minutes per session to be sure that the activity is tolerated. This could then be increased by 10% per week. Intensity could also be increased by 10% each week as the individual becomes accustomed. Strength training can help cancer survivors regain strength that is lost during active treatment and is also helpful for promoting bone health. Older adults lose muscle mass as they age, and cancer treatment can exacerbate that process. The recommended frequency of strength training is 2 to 3 times per week. The time it takes per session may vary, but 20 to 30 minutes is adequate. The type could include dumbbells, variable resistant machines, or strength training performed in a class. Progression of resistance should be slow after a cancer diagnosis for several reasons. 1. Many cancer survivors experience a time of inactivity. When one is starting to return to exercise after a period of deconditioning, there is a higher likelihood of muscle injury from overdoing. 2. There is also an inflammatory response that occurs when one progresses resistance too much. This is pertinent because cancer-related fatigue is also thought to be related to inflammation. An inflammation-related adverse effect of cancer treatment called lymphedema can cause swelling in the area of the body affected by cancer. This results from an increase in protein-rich fluid, which can happen with increased inflammation and can occur in the arms, breasts, and torso of breast cancer survivors and in the lower body after bladder, testicular, and gynecologic cancers, as well as after melanoma. As we discussed with age, range of motion generally decreases, which can make it difficult to perform common activities that require reaching out, twisting. The deconditioning that often surrounds diagnosis and surgery for cancer patients can also increase stiffness. Although specific benefits related to cancer have not been studied, inclusion of neuromotor exercise involving balance, agility, coordination, and gait may be considered as part of a general exercise program, especially for older adults. The effects of cancer on the ability to exercise or on the benefits of exercise will vary according to where the cancer occurs. For example, if a woman who had breast cancer treatment had surgery on her chest and may have elected to have reconstructive surgery, both surgeries result in changes in the way she moves her shoulders and upper body. In contrast, a colon cancer patient may have had abdominal surgery and have a temporary or permanent alteration in the manner of waist elimination, which may include an ostomy bag that is worn under the clothes. As a result, this survivor may now relate to abdominal exercises differently and wear different clothing. Additionally, a prostate cancer survivor may have issues with urinary incontinence, in part due to curative surgical procedures. An exercise plan minimizing activities that would increase leakage, like jumping, would then be desirable. Keep in mind, many cancer patients must undergo chemotherapy, radiation, or a combination of the two. Ionizing radiation continues to damage the specific area of the body that was treated for the remainder of life. Techniques are changing and improving the scatter radiation that affects healthy tissue, but adverse effects continue to be documented. For example, if radiation was received on the chest wall, it may cause damage to the heart and lungs. Development of arrhythmias is the most common radiation-associated adverse effect with regard to the heart, and pulmonary fibrosis can also occur due to radiation of the chest wall. The effects of chemotherapy are systemic, and thus the adverse effects may affect multiple body systems. The specifics of body systems affected and the nature of the changes vary according to the class of chemotherapy drugs. For example, anthracyclines are a class of drugs commonly used for breast cancer that damage the heart, increasing risk for cardiomyopathies and heart failure. By contrast, all the chemotherapy drugs that are platinum-based cause peripheral neuropathy that may be permanent. Table 14.3 provides more details on these effects and whether there is evidence that exercises can help with the issue. And this is where the PowerPoint is then going to move into cancer types. Again, I would just like you to glance through this so that you can kind of be a little bit familiar with some of these different types and some of the specifics related to these types. But since we are only testing on the previous 13 slides, as those are the slides presented in the chapter in the textbook, then I'm going to go ahead and stop this video. We'll talk to you later.